All right, good afternoon, everybody. Dr. Mehta here from DOC Pain Management. Glad you guys could join us today for our webinar. Hopefully you're staying nice and cool inside somewhere with this heat wave we have going on. But wanted to discuss today something that's very common in our practice, myalgia and chronic pain, and then discuss really what that is. What is myalgia? What does that term mean? And then look at ways we can diagnose it, treat it, and look at how patient outcomes are with respects to some of the treatment modalities. And so hopefully you take away some tidbits that you can discuss with your provider at your next appointment. So what is myalgia? Myalgia basically is a term for meaning muscle pain, right? And so, arthritis, similar to arthritis, it's a term that means joint wear and tear. Myalgia means pain related directly to the muscle. And so where can we have myalgia? You think of any muscle you have in your body, your muscles in your neck, your shoulders, your lower back, your legs, you can have myalgia related to those muscles. And so um, it's important to understand that really it can affect your whole body, can affect multiple areas in your body, even at the same time. Muscle pain can be temporary, meaning that if you have an injury, it could be an acute onset, meaning for a short period of time, or it can linger on for a long period of time if it becomes a repetitive injury, a repetitive strain, or arthritis or inflammation flaring up the muscles, right? So it can be both a short-term or long-term condition. So here's kind of a breakdown of how we see that. So when we talk about acute, we usually indicate that this is something that happens all of a sudden, a short-term issue. So common thing is that somebody gets in a car accident, they get a whiplash injury, they get neck strain. They never had neck problems before. That could result in more of an acute myofascial or myalgia type of symptom. How do these result? Basically, some injury, lifting something heavy, sleeping the wrong way, playing a sport or playing activity and getting that repetitive strain. Those are where we see more of the acute myalgia symptoms, and those typically resolve with more conservative treatments. The second thing, which we see in our practice, is more chronic myalgia, right? So this is where the symptoms are similar. The symptoms are, muscle pain, muscle aching, muscle soreness, but now it no longer goes away in a short period of time. This could be something that somebody has long-standing arthritis and now their muscles are flared up. Somebody has a previous stroke and now their muscles are sore or they're really tight. Someone has surgery, shoulder surgery or back surgery, and now those muscles are compromised because they've had to go through those muscles to access the bone and to do that surgery, right? So now those symptoms can last a long time, right? So it's good to understand the difference of someone that has more short-term myalgia, meaning acute myalgia, or long-term myalgia, which is chronic in nature. How might myalgia feel? Well, typically think, everyone has had maybe some muscle soreness in the past from doing something, sleeping the wrong way or exercising or lifting something. And so that's really the bulk of a lot of the symptoms of myalgia is muscle aches, muscle soreness. However, I do see a lot of patients that have overlapping symptoms of burning, tingling pain. They get cramping symptoms, stiffness, right? These are sometimes hallmarks of more joint pain or nerve issues, but even sometimes with patients with myalgia can experience some of these overlapping symptoms. The other important hallmark is that pain with movement. So typically, if you're rotating your neck up and down, if you're side to side, if you're, bending your back and forward, that usually results in some sort of pain and strain. And so that typically might be a culprit of myalgia that is something to look at. What are important symptoms that we should look for? When I look for myalgia or when I talk to patients in the practice about what myalgia is or what they could be experiencing, What I really want to know is where is the pain, right? Is it here in the neck? Is it what muscles is it affecting? And so we also want to know the type of pain, right? Because I want to know what's causing the symptoms today, and that could be myalgia pain. But then you could have some nerve pain, right, related to, say, a herniated disc in the neck that could be also driving some of the symptoms. And so it's important for us in the practice to differentiate how are we going to treat muscle pain that could be occurring right now and then treat the nerve pain later, down the line. We want to know how long it's been going on, how severe the pain is, if there's any weakness going on associated with this myalgia, fatigue, sleeping issues, right? These are all things that we ask not only to understand your pain better, but then also to understand ways we can prevent myalgia from happening again, and then more importantly, treat it. How can we really curb some of the symptoms that you're having? Um, when is myalgia sort of an urgent issue, right? I've seen patients complain of chest pain that we thought it was more muscular, but then they have an underlying cardiac issue that they've sought medical attention for, right? Breathing, there's muscles right along the chest line, the serratus muscles, those can be sore from repetitive twisting and turning. But if somebody has a lot of shortness of breath and rib pain, that could be a pneumonia, that could be a rib fracture, that could be something that needs more medical attention. Fever, weight loss, unexplained weaknesses, things like that are red flags that there could be indication there's other things going on aside from just the myalgia symptoms alone. How do we look at it? How do we evaluate it? Well, really, it's important for your practitioner or your provider to get your hands on you, right? To really feel those muscles. As a DO, as an osteopath, I'm really used to using my hands and really palpating the feel for some of the tissue texture changes. So I can feel where the tightness is in the muscle. Really, what we're doing is we're comparing side to side. Is there a difference in texture, in quality, in stiffness of that muscle? And so that can really help us diagnose it and understand how to treat your symptoms. Also, we look at your range of motion. We're looking at how your arms are moving together in unison, how your shoulder blades are moving in unison, how your low back is moving. And so that gives us an understanding if there's any sort of discrepancy in the muscles and the muscle bulk that can lead to this myalgia issue. And then we want to make sure your strength, your nerves, your reflexes, all that is maintained so that there's no other concern of something underlying that could be driving some of the symptoms that you're having and the pain that you're having. In addition, we want to look at what have you tried? What treatments have you tried in the past? What has worked? What has not worked? Maybe revisit some of those. We also want to look at, is there a certain position that is affecting the symptoms? And that could be working at a desk, sitting for a long period of time, on the phone, holding the phone for a long period of time, right? Those are repetitive strain movements that if we don't fix those parameters, those can only make the symptoms worse and not get better. So when we talk about treatments, we kind of touched on this briefly, but really the main thing is to come up with a multimodal treatment plan, right? And so number one is we look at activity modification. Can we change your exercise routine that's, not aggravating your neck muscles? Can we change the workstation at your desk so that you're not in a repetitive strain? Can we improve your sleeping, your pillow, your way you sleep, right, to improve that stability in that muscle over time? And so those are main things that we ask for your input to give us those things that we can adjust and give you some tidbits on for you to try at home. Second thing is physical therapy, right? Like I said, muscle pain is a really active problem. And so physical therapy is very important to not only treat the muscle pain, right, with modalities of massage, stretching. They can do ultrasound to apply heat and different modalities to reduce the pain. But then more importantly, give you the tools that you can do at home so that you prevent these from happening in the future. And so that's kind of why we use physical therapy a lot for myalgia patients, both acute and chronic, to help speed up that recovery process. Medications when appropriate, right? It's key here that when appropriate. And so most of the muscle relaxers that we have on the market typically don't treat specifically muscle pain. So they really work at the brain level to help you feel better so that you can get through your day. But when we talk about specifically myalgia and acute muscle pain, we want to do things that are going to target the muscle. And so that's where creams can help, anti-inflammatory creams, lidocaine patches, heat, cold, biofreeze, icy hot. A lot of those menthol rubs, they can really help control some of the symptoms. I tell my patients, doing a lot of in the shower, let that heat soak onto that muscle and then do some stretching after. And so that can really help support the muscle pain and the pain that you're having. Stretching and strengthening, right? It's a combination. I think I have a lot of patients that say, "Hey, you know what? I just walk and I get my exercise that way." Great. Walking is a perfect modality, but you also want to strengthen the muscles. So really isolating the groups of muscles in your body and working on shoulder exercises, right? Working on hip exercises, core exercises. Those are important to help strengthen the spine and strengthen the muscles so that when you do something like maybe sleep the wrong way or lift a box, your muscles aren't going to be overworked and they're going to be much stronger to withstand that load. And then trigger point injections, we'll talk a little bit more detail, but this is a really great active strategy to help really promote the muscle treatment and to prevent that repetitive strain. And so diving into that a little bit more detail is that basically trigger points happen all over the body. And so what they are is they're a tight area in the muscle, usually a couple localized spots that almost feel like knots. So it feels like almost a ball or a little nodule that is developed in the muscle. And so when you think about it, that muscle is the localized point for all of the strain. And so, what we think is we think of the muscle as a knot. We want normally the muscle to be a nice strand, okay, nice long tissue. And so that trigger point has developed a knot. And so that knot is impeding your ability to go through the ranges of motion, move in a localized way. It's really tender to touch in that cycle. And so what we need to do is break that knot up. And so stretching can help. Lidocaine creams can help, but it often doesn't get deep enough to where that knot is. And so that's where we utilize a treatment called trigger points. And so trigger points, what they do is they actually put medicine directly into that knot. And so what I'm doing is I'm localizing that knot into that muscle and I'm putting a mixture of lidocaine and occasionally some steroid. And so the whole idea is that, remember, we have that knot formation is to break up that knot so that now it stays into its linear structure or more of a straight line structure. And so that when you stretch, it maintains that way instead of reforming back to that knot. So we want to keep it this formation. And so that's what the trigger point does that we do here right in the office, and that we fine tune the areas and we just put a little medicine in there and it just breaks up that knot completely so that your stretch and your exercise and your lidocaine patches, your creams, that become more effective in your day-to-day routine. So here's, a list of questions that I just wanted to go through individually and kind of give you some, answers, potential answers to some of these questions that commonly get asked in my practice regarding myalgia pain. So what do you think is causing my pain, right? And so I think it could be a combination. And a lot of times I tell my patients, think of the body as a little onion. We're peeling the layers off of that onion. And so the first layer is the muscle layer. We might do an active treatment like a trigger point or treatment to really calm the muscle pain down. Once that's calmed down, then we'll go deeper into the arthritic pain. Then we'll go into the joints, and maybe we'll do a nerve block to help control the joint pain, right? So it's that combination treatment that can be helpful. Peeling that first layer, that muscle layer is that first layer that can commonly cause pain. This goes into kind of the second thing. Is my pain muscle related, nerve related, joint related, spine related, right? It could be a combination of all four. And so our job is to individually see which one is driving the pain today and kind of target our approach based on what's driving that pain. Do I need imaging or other testing? Typically for myalgia pain, you don't. We don't really, it's a diagnosis of palpation. It's a diagnosis of where your symptoms are. Doing the trigger points can actually help diagnose it based on the relief from the trigger point. That can tell us that, hey, majority of the pain is coming from the muscle pain. But yeah, rarely do we need an X-ray or MRI to identify if it's true myalgia. What are my conservative treatment options? We talked about this, exercise therapy, different injections, different creams. Would therapy help? Absolutely. So a lot of times I try to do a trigger point, and then I often have my patients go either see a physical therapist, a massage therapist, a chiropractor, even that week, because what they can do is they can reinforce what we've done in breaking up the knot and now maintain it so that the stretching is more effective and efficient for that patient. Are injections appropriate for my condition? I think we talked about that, how effective trigger points are. They're just done here in the practice. They take less than, 3 to 5 minutes to do. They're really effective in really controlling that stubborn strain that you might have in that muscle. What's the goal of each treatment, right? This can vary from patient to patient. The goal could be, being able to move my neck right or left. The goal could be being able to lift, work at my job and lift something. So the other goal could be sleeping better at night, right? It could really vary based on each patient, but the whole idea is that once we do an active treatment is to see if we're attaining that goal. How do we measure progress? We kind of touch base after these treatments are done to see what's improved, what's not improved, and then hone in from there. I should say that these can be repeated, right? So we know how vast the muscle network is. The muscle pain can move. One day the pain could be here, we treat it with trigger points, and then now the pain is in the lower back, right? And so we can now target that again with some trigger points. So there's never really a downside to doing the trigger points or the active muscle treatments because we know pain can move, pain can change, pain can alter. And so we can really target those areas regardless of where your pain is. Um, Understand in your condition, pain can flare, right? You might have a chronic arthritic pattern, but now you have a car accident. You might have acute pain that we can calm down to get you back to your baseline, right? So understand that there might be flare-ups of muscle pain that can happen. And our goal and your goal is to tell your provider so that we can actively treat it to improve your symptoms. When do I seek medical care? Really, we talked about the urgent issues. If there's, weakness, bowel bladder issues, neurologic deficits, that's a concern. But like in our clinic, we screen for those, we evaluate those to make sure that there's no serious underlying condition before you get myalgia treatment. And so, just really to end here as some takeaways before we open it to questions is, myalgia in a nutshell means muscle pain, right? Think of any muscle in your body that could be a source of tightness, discomfort, inflammation. I often see muscle pain not alone. Muscle pain also goes in conjunction with arthritic pain, with nerve pain, right? So a lot of times in our treatment plan, we're treating both. We're treating the muscle and the underlying issue. We talked about the wide range of treatments, therapy, stretching, medications, trigger points. These are all required in unison, right? They're all required together to really get that muscle to recover over time. And like I said, the goal here is to improve your function, your sleep, your mobility, being able to, actively engage so that you can exercise and hopefully prevent this from, being an ongoing issue in the future. And so that's all I had from the talk. So I will go ahead and you can unmute yourself if you have any questions. Here's a question on the chat function. Is that soft wave a possible treatment for myalgia? I'm not really sure what the soft wave is, if it's talking about ultrasound. Um, that ultrasound is a good therapy. One thing that also comes to mind on this topic is TENS unit. So TENS unit are those electrical stimulation uses that you can get at any drugstore. And they have sticky pads that you can put on certain areas. So those can be effective in controlling muscle pain. And so you can turn stimulation on and off, and that can really be helpful. So I'm not too familiar with SoftWave if that's a specific company or a specific modality, but TENS units can be very beneficial in treating muscle pain as well. Does anyone else have any other questions? Great. Well, again, thank you all for joining for today's meeting. Feel free to, ask your provider in the office if you have any questions or, thoughts about muscle pain or myalgia. They're all very well versed in treating this in our practice. We look forward to, the next meeting. Hopefully, you guys have a happy 4th of July and stay cool out there. All right. Thank you.